From NBC News, this is Today, live from Studio 1A in Rockefeller Plaza.
Turning now to two alarming new studies highlighting the dangers of smoking, especially for women. One suggesting that longtime smokers who develop breast cancer have tripled the risk of dying from that disease. Dr. Erica Hamilton is an oncologist and associate director of the breast cancer program at the Sarah Cannon Research Institute. Good to have you with us this morning, Dr. Hamilton.
Thank you so much for having me, Erica.
So this one study in particular, this isn't about, we know that there is an increased risk for breast cancer if you smoke. This is not about smoking as a cause for breast cancer. This is about the survival rate if you're a smoker and you develop breast cancer.
That's exactly right. So the link between smoking and developing breast cancer really hasn't been as well defined as smoking and some other type of cancers like lung, pancreas, and kidney cancer. You're exactly right. This study didn't look at whether smoking causes women to develop breast cancer, but instead looked at those women who smoke that have breast cancer are 3 times more likely to die of their breast cancer than those who don't.
And that's really high. It also looked at the length of time that women smoked. And I'm guessing that the longer you smoke, the greater the impact?
Right. Specifically in this group, that if you smoked for more than 20 years or 2 decades, you are at particularly high risk of dying from your disease.
So one thing clarify for us here. Was this women in the study who were still currently smoking when they developed breast cancer, or does this apply if you smoked for 20 years, quit, and then got breast cancer? Does this also affect your survival rate?
That's a good question. And in this particular study, it was women that were still currently smoking. And so I think this just reaffirms for us that there's no time that's too late to quit smoking. And I think it's encouraging for anybody that is smoking to still have that motivation to quit smoking now.
Well, and then there's this separate study, which was really surprising to me. So as we're seeing overall smoking rates in the country decline, which is a good thing as we know for our health.
Exactly.
There's this separate piece that young women between the ages of 18 to 25 are very light smokers. And that's defined as 5 or fewer cigarettes a day, which seems actually kind of high.
Right. I think this is the kind of social smoking phenomenon. This particularly was 5 cigarettes a lesser day, or not even smoking cigarettes every day, but occasionally. And these women were still at very high risk. So I think, we've seen, particularly in the news over the past several years, that alcohol in moderation, 1 drink a day or less, is not necessarily bad for your health and may even be protective against things like heart disease. But for smoking, I think this just reaffirms that no amount is safe. Any smoking is too much.
And any smoking, especially for a woman, can, as we're knowing now, can have this effect, because even if you consider yourself this very light smoker, that could still affect you with things like breast cancer later on, right?
Exactly. And I think what's dangerous about this very light smoking is that when they go to see their doctor, they may not even consider themselves smokers because they don't smoke every day. So if you ask the question, do you smoke? They may answer no. So it's important for us as healthcare providers also to realize to ask the question of when's the last time you've used tobacco to capture these people and then be able to tell them how dangerous it really is.
Great advice. Nice to have you here. Thanks for coming in this morning.